The Centers for Disease Control and Prevention, the very institution built to guard America from the next plague, is now facing a crisis not from viruses, but from politics. What we're witnessing is no ordinary shakeup. It's a purge, a revolt, a slow-motion collapse of expertise at the hands of political opportunism, conspiracy-fueled ideology, and a government more interested in appeasing extremists than protecting public health. It began with the ouster of Dr. Susan Mons, a director confirmed just last year with bipartisan support. She wasn't fired for incompetence or scandal. No, she was pushed out because she refused to bend to the will of Robert F. Kennedy Jr., Trump's hand-picked health czar, who is now rewriting vaccine policy based on quackery instead of science. Her crime? Refusing to bow down to a political agenda that limits vaccine access in the middle of a new surge. Almost immediately, resignations rippled through the agency. The head of the zoonotic division, gone. The CDC's chief medical officer, out. The head of the vaccine unit, quit. These aren't minor figures. These are pillars of public health, experts with decades of experience. Their exits leave gaping holes just as the nation heads into respiratory virus season. And let's be clear, this isn't just paperwork and policy. It's life and death. Here's the new rule under Kennedy's decree. Americans can no longer just walk into a pharmacy to get a COVID booster. Instead, you'll need a doctor's appointment, a prescription, a bureaucratic hurdle standing between you and protection. And if a doctor dares to write that prescription against the new restrictions, Kennedy has practically invited lawsuits against them. Imagine that, the government encouraging patients to sue their doctors for trying to save lives. It's not just reckless, it's sabotage. Think about who gets hurt here. It's not just the elderly, it's the young parents living with grandparents in multi-generational homes. It's the workers with chronic conditions who don't qualify under Kennedy's arbitrary cutoff. It's the millions who still worry about long COVID, who want protection, who rely on convenient access at their local pharmacy. And overnight, that access has been strangled. Pharmacists, who administer the bulk of vaccines nationwide, can't override this order. Unlike physicians, they have no leeway. So, while an MD could still try to prescribe off-label, the pharmacist at your neighborhood Walgreens or CVS now has their hands tied. That's how sweeping Kennedy's power has become. With the stroke of a pen, he's made life-saving medicine harder to get for millions of Americans. And let's not forget the backdrop. Just weeks ago, the CDC's Atlanta headquarters was the target of a domestic terrorist attack carried out by an anti-vaccine extremist. Hundreds of bullets riddled the building. A police officer, a black officer, was killed defending the very people who dedicate their lives to fighting disease. And how did the government respond? Silence. No speech from Trump, no moment of mourning, no vow to defend the CDC. It was as if the attack was not only ignored, but tacitly encouraged. Imagine working inside that building, already reeling from violence, and then watching your leaders dismantle your mission from within. The irony couldn't be sharper. These experts, scientists who served under both Republican and Democratic administrations, weren't taken down by disease. They were taken down by politics. Dr. Mons, once seen as a consensus pick, was shoved aside because she asked a simple thing, that commitments made to protect vaccines actually be honored. Senator Bill Cassidy, a Republican and a physician himself, had vouched for Kennedy's word, and Kennedy broke it. Cassidy was left embarrassed, betrayed, and complicit. So what now? The leadership vacuum is real. The vaccine unit, leaderless. The zoonotic disease division, the team that monitors threats like Ebola, bird flu, and yes, the animal origins of COVID, suddenly without a head. And the CDC director's office? Empty. This at the exact moment when viruses don't care about politics, when pandemics don't pause for partisan theater. The irony couldn't be sharper. These experts, scientists who served under both Republican and Democratic administrations, weren't taken down by disease. They were taken down by politics. Dr. Mons, once seen as a consensus pick, was shoved aside because she asked a simple thing, that commitments made to protect vaccines actually be honored. Senator Bill Cassidy, a Republican and a physician himself, had vouched for Kennedy's word, and Kennedy broke it. Cassidy was left embarrassed, betrayed, and complicit. So what now? The leadership vacuum is real. The vaccine unit, leaderless. The Zoonotic Disease Division, the team that monitors threats like Ebola, bird flu, and yes, the animal origins of COVID, suddenly without a head. And the CDC Director's Office? Empty. This at the exact moment when viruses don't care about politics, when pandemics don't pause for partisan theater.
And let's be clear, the danger isn't just the absence of leadership, it's who fills the void. Will it be serious scientists with bipartisan respect? Or will it be political loyalists like Robert Malone, Marty Makary, or Jay Bhattacharya, figures who've made careers cozying up to power and downplaying science? If that's the future of the CDC, then the agency once known as the gold standard for global health will be reduced to a megaphone for pseudoscience. The consequences aren't abstract. They're measured in hospital beds filled with patients who thought they were safe, in doctors second-guessing whether to recommend care for fear of lawsuits, in pharmacists turning people away, in parents unable to shield their children or protect their elders. This is how public health erodes, not with one big collapse, but with a series of deliberate cuts until the safety net is shredded beyond repair. But here's where the story turns. Personnel matters, leadership matters, and political pressure matters. Senator Cassidy, chair of the Senate Health Committee, still holds power. He can block the appointment of charlatans. He can insist on qualified, respected candidates. His silence so far has been deafening. But silence is complicity, and history is watching. Will Cassidy save his legacy or bury it by enabling this demolition of public health? And beyond the Senate, the responsibility falls to us, the public, to doctors who refuse to abandon their oath, to medical organizations like the American Academy of Pediatrics, which has already begun openly challenging Kennedy's policies, to everyday citizens who demand that science, not superstition, guide decisions about their health. The question is no longer whether expertise is under attack. It is. The question is whether we will fight to protect it. The CDC is not just another federal agency. It is the firewall between civilization and chaos, between prevention and outbreak, between science and ignorance. When that firewall is weakened, pathogens exploit the cracks. And history shows us what happens when politics replaces science. Plagues spread, trust collapses, lives are lost. The mass resignations at the CDC are not just a bureaucratic reshuffling. They are a five-alarm fire, a signal flare that the nation's public health system is being gutted in plain sight. It's the Constitution's promise of protecting life, liberty, and the pursuit of happiness, tested not in the courts this time, but in hospitals and clinics across America. So as Trump and Kennedy redraw the rules to satisfy an anti-vaccine base, as experts walk out the door, as silence echoes from leaders who should know better, the stakes grow higher. This is not just about vaccines. It's about whether truth still matters, whether science still stands a chance, whether the people in charge care more about ideology than the lives they swore to protect. And so the story ends where it began, with a revolt inside the CDC. Except this revolt isn't about politics, it's about conscience. Doctors, scientists, and public servants refusing to betray the truth, even if it costs them their jobs. That courage may be the last shield standing between America and the next great outbreak. Because in the end, diseases don't wait for elections. Viruses don't care about polls. The only question is whether we will listen to science or bury it under politics, until the price is paid in blood.